Canada's top tech expert turns geek speak into street speak. Tech Talk with Mark Saltzman on News Talk Radio, CJAD 800.
Hey Canada, welcome to Tech Talk. I'm recording this show from Paris, where I'm attending VivaTech 2024. This is Europe's biggest tech and startup show. It's the 8th annual event, in fact, and so not an old convention, but massive. It takes place at the Expo Porte de Versailles Conference Center to host the 100,000 or so attendees. There were about 3,500 exhibitors from all over the world, and AI, artificial intelligence, was the pervasive theme, as you might expect. I recorded some interviews to play today and next week too, and I was fortunate to be brought here as part of a Canadian delegation of not just 60 companies, most of them startups, but a handful of journalists too. So it's been quite a week. I'm recording this show from my hotel room. Today on Tech Talk, we'll kick things off with a Vancouver-based company called Trusting Pixels. They've developed technology to spot manipulated photos and videos by advertisers who are trying to mislead the public with doctored images. You know, when they try to make a model on the cover of Vogue look super thin and a pronounced jawline and an airbrushed face, perfect hair, all of that. We're going to hear how Trusting Pixels works. The founder of Trusting Pixels met with the French President Macron on Wednesday. How cool is that? Speaking of VivaTech 2024, I sat down with Isabelle Turcotte. She is Chief Marketing Officer at Scale AI. This is the company behind the delegation that brought me to France, and she'll be here to explain what they do for Canadian startups, including a conference in Montreal called All In this September that you're going to want to hear about. Also on Tech Talk this hour, we learn about YouTube Health for those seeking trusted medical information online. And then we'll hear about Nanny AI. It's an app for iPhone and Android users that claims to determine why a baby is crying to help out stressed parents and babysitters. All of this and more on an all-new Tech Talk powered by Epson Canada, which I'll tell you more about shortly, but let's officially kick off the show with our first interview. All right, so as I mentioned earlier, I'm here at VivaTech in Paris, and I'm at the Canada Pavilion, sitting here with Alex Jacquet. He is the founder of Trusting Pixels, and we're going to hear all about the AI that they're applying to photos and videos for multiple applications, including social media. So first of all, thanks so much for your time, Alex.
Yep, of course, my pleasure.
All right, so why don't we start with what is Trusting Pixels all about?
Sure. So Trusting Pixels is a company that essentially helps organizations detect fake videos of people, specifically retouched videos, and even more specifically in advertisements.
Magazine covers like Vogue or what have you has been heavily doctored. So who are you serving in essence?
So right now the most interesting clients will be essentially consumer authorities, consumer associations that try and protect consumers from this type of content. There are, I don't know if you know about this, but essentially in the past there have been ads taken down because they've been too retouched. And now you actually have laws in countries, very strong policies in other countries against this sort of stuff. So we want to actually serve ultimately consumers, but more specifically, we'll be providing our technology to consumer authorities, consumer associations as well.
All right, so we're here in the EU, obviously. They're notoriously strict for all things tech. Is this like a prime market for you?
So prime. It's so ironic that we came here and we got invited here at the time we did, because I started conversations with different governments, and this has now allowed us to actually potentially meet with them, talk with them. The EU is definitely leading the way when it comes to consumer protection, by far. As I mentioned, a few countries have laws, and even the countries that don't have laws have strong policies in place. So it's definitely the place to be to provide our software for, because they're really taking a lot of efforts.
Before I ask you how it works, how you can detect a fake image or a doctored video, about a week ago I saw that TikTok announced that it was going to flag AI-generated video content. We've heard of these like virtual influencers and all that. That's a whole other thing, right? Because they're not real from the start. Whereas the technology that you're working with, it's a human that has been tweaked to look better than we really are.
Exactly. The presentation I have tomorrow is going to touch up on a lot of this. And so regarding TikTok, yeah, I think you're right. I think it was labeling stuff that's been completely generated, but that doesn't mean they're going to label things that have been retouched. It's a different beast, even when it comes to down to the tech. Like, we will be building models, machine learning models that can detect generative AI, but right now our focus is retouched videos.
Okay, so if I'm on social media, let's say Instagram or TikTok, and I shoot a video of me and then I want to Photoshop, just manipulating it, where I want to make myself look taller, thinner, my skin looks better, is there some technology that Trusting Pixels can pick up on over others? Like, is it like a smoothing out filter? Is that going to get past your software, or is that going to be flagged as well?
That'll be flagged. It's funny you say smoothing. We've actually trained a lot of our models on smoothing specifically. And to add to that, do you know what's the most common retouching edit? It's skin. And even more specifically, it's skin smoothing. Literally, when you open TikTok, their beauty filter, it's a softening filter. Right. And we've trained our models on that as well.
Well, you brought up a good point, Alex, that a lot of these built-in tools have an auto touch-up feature.
Yeah.
You would think it's allowed if it's built into iPhone or Android. You know, you tap the little magic button and all of a sudden you look younger and you don't have bags under your eyes.
Yeah, so the softening will pick up for sure. We're working on more and more different types of skin editing, and we also pick up warping. So if you made someone's nose smaller, lips bigger, which is very common, eyes bigger, which is even more common, we pick that up. We still have a lot more retouching edits to pick up on, but we've covered some of the big ones, which is why we've actually been catching a lot of stuff.
I'm chatting with Alex Jacquet. He is founder and CEO of Trusting Pixels, a Vancouver-based startup that's leveraging artificial intelligence to detect manipulated photos and mostly videos. We're here at VivaTech 2024. If you're just joining us for the first time, forgive the noise. We are at the Canada Pavilion. There's a lot of activity here, which is very cool. So is social media one of your biggest platforms, or is it traditional magazines or TV ads?
So definitely social media. And to be a little more specific, we also focus on TikTok a lot because it's video centric. And what I mean by focus is like we've actually downloaded lots of content from there, because when you upload something to a social media platform, it gets compressed. So we wanted to make sure that our machine learning models can download something from a social media platform that's been compressed and still pick up stuff. And it has, especially from TikTok.
Let's say there's a famous celebrity that has a video on TikTok and it's clearly been manipulated to make them look better than they really are. Whoever's hiring you, you would send the report to them and flag a video. But let's say it's a public figure or even just a regular person like me. Does it get taken down? Do you notify the social media platform?
Yeah, good question. So we're not here to like beat down on the normal public.
Just have transparency.
Yeah, listen, a lot of people do edit their photos or videos, but this is not about not doing it. It's more so about there's a wrong place to do it, and it's very specific to advertisements, and that's why consumer authorities are taking these things down, because it's not fair to show this perfect skin that's been smoothed out and then sell a skincare product. Right. That's where the wrongdoing is, and that's the type of content we've been on the side on our own, been researching and analyzing, and the results have been horrifying.
Well, there's a lot of impressionable tweens and teens out there that have been set with these unrealistic expectations, and they're comparing themselves to that. So this is obviously a big issue that's been going on for many years. Without getting too technical, can you give us a rough sense on how it works?
So this is actually the software. I know listeners can't see, but
this is like an iPad that has an interface on it.
Yep. So essentially people just literally upload a video, and it will spit out a result, whether it's authentic, retouched, and it'll actually give you the percentage of how authentic it actually thinks it is or how retouched it thinks it is. So it gives you a score as well.
But what if someone's face really is that smooth, or what if they really are that slender? There won't be a false positive.
Great question. So I made sure that when we were building our data set, we had people of all various types of skin. We also made sure that we had people wearing makeup, because it could think that that's softened skin. So we have a really large variety of different skin types. This way the model doesn't screw up on that.
Awesome. Before I let you go, what's next for you?
What's next?
You met with President Macron, I should mention. You met with the French president. Yeah. How was that?
It was amazing, kind of surreal, exciting, because, France is actually doing a lot of work towards this, and I'm hoping to be working with them. So I'm hoping what's next is that we work with the French government, because here's the thing. What's been an issue is that when we speak to different governments, and we have been, they think it's a problem that's inside the borders of their country, and it's not. Anyone in this country in France can look at content from someone in the US. So it's important that we as a society work together, because France can be doing a great job, but their consumers are also going to be looking at content in the UK, in Norway. So I hope that we could be the central organization that can help them audit all content for the same purpose, because all these countries are doing it for the same purpose. And they got to stop thinking no, we're going to do maybe, we're in France, we're going to choose a French company, we're in Norway, we're going to use a Norwegian company. This is a global issue, and we have to work together.
The internet knows no borders.
Exactly. And this issue doesn't matter where you live. And I'd say North America has probably the largest impact, especially the U.S., because there's a lot of celebrities there. And so they're going to be, no matter what country you're in, even if it has a law, your kids, your consumers are going to be consuming content from other countries as well.
Fair enough. And then finally, the best website to learn more?
Trustingpixels.com.
Great name, by the way.
Thanks.
Trustingpixels.com. Alex, thank you so much. Have a great rest of your show.
Thank you so much.
Again, apologies for the noise that was recorded at VivaTech 2024 on the show floor. In fact, at the Canadian Pavilion, where there were about 60 companies exhibiting, which was really cool. So that was Trusting Pixels. Also this hour, I'm going to sit down with Isabelle Turcotte. She is the CMO for Scale AI. That's the company that brought this Canadian delegation to France for this convention. Also this hour, we're going to chat with YouTube Health and learn about an app called Nanny AI as well. So a lot more tech talk coming up. Before we continue on with this show, I do want to remind our listeners that while we often talk about new gadgets on this program, it's important to properly recycle your old tech, your end-of-life electronics, and it's never been easier to do it. Simply visit recyclemyelectronics.ca, type in your postal code or your address, and you'll find one of many drop-off locations near you. By responsibly recycling your end-of-life electronics, you're keeping them out of the waste stream, and you're helping to recover and recycle valuable resources, which can then be put back into manufacturing. When it comes to your devices, the future is literally in your hands. Don't let it go to e-waste. That website again is recyclemyelectronics.ca. We go back to the show floor at VivaTech 2024 to chat with Scale AI. Stick with us. We'll be right back with more Tech Talk.
Canada's top tech expert. Tech Talk with Mark Saltzman on News Talk Radio, CJAD 800.
Welcome back to Tech Talk, powered by Epson EcoTank, one of the biggest innovations in the printer space to date. If you have not yet heard of the EcoTank family of all-in-one printers, which of course are also scanners and copiers, out of the box, they ship with up to 2 years worth of ink. When it's time to buy more ink, they're in bottles instead of cartridges, saving you up to 80%. Epson EcoTank printers work wirelessly with all your devices. Check out Epson EcoTank printers in store now or online at epson.ca/ecotank. If you're just joining us now for the first time this hour, I'm in Paris for a convention called VivaTech 2024, recording this part of my radio show in my hotel room. But as you're going to hear in a minute, it's a little bit noisier when I hit the showroom floor. As I catch up with Scale AI, this is the organization that brought a delegation to France, including yours truly, and a couple of other journalists, and more importantly, 60 startups that are doing really interesting things in the country. And so let's get to that interview with Isabelle to hear about this organization and what Canada's doing in the AI scene, and some info on an upcoming event happening in Montreal as well. So let's get to it. So I'm here at VivaTech 2024 with Isabelle Turcotte. She is the Chief Marketing Officer for Scale AI and CEO of the All-In event to embrace the Canadian tech ecosystem. Thank you so much for your time, Isabelle.
Thanks to you. Very happy to be here.
All right, so we found a quiet-ish area of the very busy VivaTech 2024 event. I was fortunate to be part of this Canadian delegation of journalists and exhibitors here. So why don't we start there? What is Scale AI, and tell us what we're doing here at VivaTech 2024.
Scale AI mandate in Canada is to fund AI projects. So that's our very first mandate. So far we've funded 120 projects for $600 million. And our second mandate is also to create an ecosystem with AI. So basically helping companies creating solutions and product that can be resell in Canada, but also elsewhere. And that's the main reason why we're here at VivaTech in Paris, is to help our Canadian entrepreneurs to be able to export and find markets outside of Canada.
And is this private investment or is this government funded?
It's an OBNL, and it's mainly funded by the federal government.
Tell us a bit about VivaTech 24.
So we brought with us 60 organizations and a lot of organisms that are helping also startups. So in total, we are more than 160 people on site here from Canada. Of course, with a delegation like this, there's a lot of political discussions that are happening also. So we had a lot of discussions with the French government, with OCDE, with the Organization for the Francophones out in Europe and Africa. So there's a lot of interest for what we do in AI in Canada. In the past few years, we've invested a lot in terms of research and helping our academics. So we've created a lot of good talent. Now it's a great opportunity for us to convert this into business opportunity also.
Both for Canadians as well as you hinted at, for other countries and other markets who can leverage Canadian technology.
Exactly. Like we have a little edge in some areas where we have developed solutions that can be used elsewhere. And all these solutions that are developed with an AI component, I'll give you a concrete example.
Please.
One of the startups that are with us called Erudi, and they basically have developed an HR, we call it HR tech solution. So they basically help optimize how we manage our human resources. So they sell in the port here in France at the Havre, but they've been also selling in various ports around the world. So that you make sure that we have the right human resources when the boat arrives. So you can even predict when the ship will be there, what the ship contains, so that we have the right resources skill to be able to unload those ships. And so it's an optimization for the company itself that managed the dock, but also for the resources that are not being called and be waiting for the ships to arrive. And it also these all solutions specifically for Erudi that was created during the COVID time, when we had for the first time in our history into trying to optimize the management of our maritime business and our port due to, for example, masks. Like we had to know when the masks were coming, we were all waiting for them. So in which ships are they, where in the ships, and how can we unload them first? So that's a concrete example of the use of AI that we have success in selling elsewhere.
All right, so AI is the common thread among all 60 organizations that you helped to bring to VivaTech 2024. That was a great example of one, helping organizations do more with less. Are there any other exhibitors here? I know I can't ask you to pick one over the other, like a favorite, but is there another maybe consumer-facing example of AI that the average person could benefit from?
Yeah, there's an example I like to use because it's very easy to understand. It's Vauban that has developed a solution in the agriculture area for potato production. So there's a company in Quebec called Patate Dolbec. They produce potatoes, and basically they have started using robotic in their field or their plant to being able to sort out the potato. But the robotic arm needed intelligence, and that's where AI comes into it. So with AI capability, the arm could pick which potatoes will be used for what, and which potato may have some disease, or so the sorting out of the potatoes is done with AI.
Like which ones are used for poutine, for example. That's very important.
Exactly.
Maybe one more example of a company that is leveraging AI that you can think of here at the Canadian Pavilion at VivaTech.
So out of the 60 that we have, they all have solutions and product, but that are applied to industries. So I'll give you an example of the construction industries. Crate, which is a very something that we use in every construction site. So the AI application that has been deployed is to make sure that the right crate are on the right side of construction, but that the driver of it has the right card for the size of the crate, and that has allowed us to really improve in terms of not having crates moving around and being at the right place. So optimizing their routes going to sites, but also making sure that on site they stay less time. So it has an impact for the company that operates the crate, but also for the construction site into optimizing. And it has ultimately an impact on the environment because we use less resources. We're optimizing and being more efficient.
Love that. As we wrap up, Isabelle, we're chatting with Isabelle Turcotte, CMO at Scale AI. Tell us a bit about the All-In conference, of which you're the CEO of.
Yeah, exactly. So basically, I've started saying that one of our mandate is to fund AI project, and we've done several of them in the last 5 years. But our mandate is also to create an ecosystem. So what does it mean is that to make sure we have demand for AI, so helping companies adopt, but also making sure we have an offer, so helping solutions and product to be developed. So All-In was meant to put like a spotlight on what we do in Canada, what we do great amongst us for further adoption within the Canadian economy, but also ultimately to showcase it to the world. So that's what we've done in the first edition last year. We're doing a second edition in September. It's in Montreal. We're expecting 3,000 people. It's really addressed to the audience. The main audience are the business people that are looking at how AI can help them being more efficient in their own business. So we will address industries by saying like how AI is transforming manufacturing. And we go into concrete example of how manufacture is being transformed or how AI is transforming our financial sector. And there's a lot of concrete example from various banks and insurance company on how they are applying AI. So it's a very concrete show to address business people.
And what's the best website to learn more about All-In as well as Scale AI?
allinevent.ai.
All right, allinevent.ai, and then for Scale AI.
Yes, of course. So Scale AI will be scaleai.ca.
All right, scaleai.ca. Isabelle, thank you so much for your time today. Have a great rest of your show. Thanks again.
It was a pleasure. Thank you.
I got a chance to practice my very limited French this past week, which was good. I'm sure the locals were rolling their eyes, but I did my best with a smile on my face, and it's all about effort. Anyways, I hope you are enjoying the weekend so far. After this short break, we're going to catch up with YouTube Health to learn about trusted videos tied to medical information, including Canadian organizations like from the UHN Hospital Network in Toronto, Sick Kids Hospital, CAMH, and some American facilities too. Then after that, we're going to go to Montreal to learn about an app called Nanny AI. Yep, AI, to help you determine why your baby is crying. Are they tired? Are they hungry? Are they in pain for whatever? So this is meant to help decipher what your baby is crying about, like a cry decoder. The company, by the way, is called Ubenwa Health, and we're going to chat with Charles Onu, the CEO and co-founder based in Montreal. More tech talk coming right up after this.
Whether you're shopping around or looking for the on button, he can help. Tech Talk with Mark Saltzman on News Talk Radio, CJAD 800.
When the internet was young, doctors strongly encouraged patients not to turn to the web for medical advice. But now there are some trusted sources, thankfully, and you can add YouTube Health to that list as they're working to help viewers find quality health information created by credible sources. Joining us to explain is Dr. Garth Graham, Director and Global Head of Healthcare and Public Health at YouTube. Hi, Dr. Graham. Thanks for your time today.
Mark, thank you for having me.
Why don't we dive right in? At a high level, what is YouTube Health?
Yeah, so, we know that people are coming to places like YouTube for health information. And so YouTube Health is our company-wide initiative to help deliver high quality health information to people who are looking for it on YouTube. So we do that through having certain features on YouTube that highlight quality information and bring quality information to the surface, but also by working with partners and doctors and nurses and therapists and organizations across the world to bring high quality health information to YouTube.
All right. So is it that you're vetting this content or they're trusted sources that have to pass like a stringent accreditation kind of thing?
Yeah, that's a good question. So I would say the overall goal is to bring the best quality content to users who are looking for health information. And so how we do that are through a couple of things. One is by labeling health information, by putting panels on videos to help viewers identify the content coming from authoritative sources. And then we create something called content shelves that pop up when people are looking for information on certain health topics, and it shows up. So what we do is we work also with a lot of content creators, maybe institutions or individual people around the quality content as well. So really what we do is try to help identify and label appropriately the content sources that are more likely to deliver high quality information, and then have those surface early in people's journeys looking for health information.
Thanks for that. Can you then walk us through how it works? So, for example, let's say I wanted to look up a symptom I was having. I don't know, I think it's heart related, or maybe I need some mental health advice. How would it work? Do I go to youtube.com or the app?
Yeah. So now say you're on regular YouTube and you're looking for information about diabetes, hypertension, something about health. What would happen is you would show up as part of your search what's called a shelf, which is a content area of information, a carousel of content that says from health sources. And so, directing you to content from those health sources. So when you click into that, the health sources would have also a label on their videos that says, from an accredited hospital or from a government institutions, or as we are doing in the US and in Canada now, it would say, from a licensed doctor or from a licensed nurse or from a licensed therapist. And so it's really helping to identify and help people engage with information coming from, quality, trusted health sources.
Why was this created? And is it live now or coming soon?
It's live now in the US and also live now in Canada, although on the Canadian side, just starting up now. And so we're just opening up the process now for Canadian doctors, nurses, and therapists, et cetera, to apply. So why was this created? Well, we knew that people were coming to YouTube for health information. And we wanted to make sure that we were identifying kinds of sources that people could trust for that information. Now, Mark, one of the things is even that step was not an easy step because, who gets to call a source a trusted source versus not? We didn't want to be the arbitrators of that information from the YouTube side. So the National Academy of Medicine, which is this organization that tackles, very challenging healthcare questions independently, made up of experts from a variety of different contexts. They took on the question of identifying credible source of information, and they worked with the World Health Organization to make that global in context. And so they identified both, the kinds of sources of health information, as well as, the processes by which someone gets that authority. And then we just as well, when the platform's working with them, took that and ingested those concepts into our product features. But it's certainly available for any platform who would want to take on a leadership role in this context with us as well. And so that's kind of how we did this process. And then for individual doctors or nurses to apply to get that label, they apply, we vet whether they are licensed, confirming the licensure in their country, and then, make sure they don't have any community guidelines, strikes against them in terms of misinformation and things along those lines. So it's an overall process with the end result being the user getting information or getting the cues and clues that information that they're getting is coming from a more trusted source.
We're learning all about YouTube health with Dr. Garth Graham, a cardiologist, researcher, and public health expert who joined Google in 2020. He's now director and global head of healthcare and public health at YouTube. Is this new YouTube health initiative free or is it part of YouTube Premium?
It's free. And that's one of the amazing things about places like YouTube. You can go to YouTube and get free health information from some of the best and brightest people in terms of healthcare institutions, creating content for health information from Cleveland Clinic, Mayo, UHN, Sick Kids in Toronto, some of the best and brightest in terms of global healthcare quality. And again, it's free. So that's one of the things that excites me about this work is we're able to bring quality health information to scale. I often say, Mark, not to get too academic, it's like taking the information from some of the best and brightest out of journals and textbooks and bringing them into, living rooms and kitchen tables where, people are able to open up their YouTube online on their phone or otherwise. So, interesting way of democratizing health information.
Yeah, I really like that. I'm a visual learner myself, Dr. Graham, where it's not unusual for me to turn to YouTube to learn how to, fix a toilet or how to do some other things around the house that I would never have learned before YouTube. Reading it with words, I don't know, I liked seeing someone else do it and then I can usually mimic it. I just changed a car battery in my son's vehicle that I would have never dreamt of trying to do myself, but it was really easy. I just had to see somebody else do it. So I love seeing that same thing applied to health information. And does this work with all versions of YouTube? Like, again, I asked about the app or website earlier, but what if you have like a Google Smart display, like, Google Nest Hub Max kind of thing?
Yeah, it works with all the different versions of YouTube. The labeling and the health information shows up. Mark, you were articulating something that is true about, YouTube is the number one learning platform around the world, right? And people learn a lot of different ways. And that's how we have to be with health. We have to start to make sure that health information is just like that. People are able to learn just as you did about how to fix a battery. They have to learn about what is hypertension and what the diagnosis that they got means. So all of this is really part of just meeting people where they are.
Love it. All right, Dr. Graham, as we wrap up again, so just youtube.com or the app or as any other device that you mentioned that carries YouTube, you just do a search for your question, and then you will see that video tagged with the source like Mayo Clinic, CAMH. And along with the institution or organization, you'll now also see the medical professionals tagged like doctors or mental health experts and so on. So that is the latest addition to this YouTube Health Initiative.
Yeah, that's exactly right. Yeah, it's just on regular YouTube, just a better way to help guide you in your health journey.
All right. Thank you so much for your time. Be well. Thanks again for chatting with us today.
Thank you, Mark.
You are listening to Tech Talk. This show is brought to you in part by LG Canada and its award-winning Ergo monitors. Experience a comfortable, more flexible desktop setup. Ergo, which is of course short for ergonomics, this Ergo design brings an innovative ergonomic arm to fit your needs. Secure the stand, monitor, and cables with its C-clamp. One-click mount and simple cable management in seconds. Easily adjust the pivot, height, and tilt, and work with improved posture and productivity. More info on LG Canada's Ergo monitors is at lg.ca. I also like to recommend that 20-20-20 rule to reduce eye strain when you're working on your computer. Every 20 minutes, look away about 20 feet for 20 seconds. That's the recommendation. I can't remember who coined that. It's some expert, obviously, but love that piece of advice, the 20-20-20 rule. Every 20 minutes, look away, 20 feet away for 20 seconds, and that'll hit the reset button on your eyes, which is great. Hey, speaking of health, we just learned about YouTube Health. And when we return on Tech Talk, we're going to learn about an app called Nanny AI, developed out of Montreal, that's designed to decode why a baby is crying, since it can't tell you themselves why they're upset. So this app uses AI for iPhone and Android users to help you or your babysitters give you some advice on what's going on. Curious to know how it works, so of course I'm going to ask about that. I'm your host, Mark Saltzman, recording this weekend's Tech Talk in my hotel room. I'm in Paris, France, down the street from the VivaTech conference. We've played a couple of interviews recorded on the show floor this hour, where it's a lot noisier. I kind of think it fits the vibe. It kind of gives it a little bit of extra energy. In fact, there will be 2 more interviews next weekend from VivaTech 2024. But hang tight, we're going to catch up with Nanny AI, based in Montreal, when we return on Tech Talk.
Get the most out of your gadgets. Tech Talk with Mark Saltzman on News Talk Radio, CJAD 800.
Welcome back to Tech Talk, powered by Epson EcoTank, one of the biggest innovations in the printer space to date. If you have not yet heard of the EcoTank family of all-in-one printers, out of the box, they ship with up to 2 years worth of ink. When it's time to buy more ink, they're in bottles instead of cartridges, saving you up to 80%. Epson EcoTank printers work wirelessly with all your devices. Check out Epson EcoTank printers in store now or online at epson.ca/ecotank. Let's face it, new parents need all the help they can get. Having 3 kids in 2 years, I can relate. Yes, we had boy-girl twins followed by another boy shortly thereafter. And so technology can play a role here in understanding what your infants want. As we're going to hear now about an app called Nanny AI with Charles Onu. He is the CEO and co-founder of a Montreal-based company called Ubenwa Health. Hi, Charles. Good to chat with you.
Hello, Mark. It's a pleasure to be with you here today.
Now, it's been said good technology solves a problem. So with that in mind, tell us what Nanny AI is all about.
Yes, definitely. So Nanny AI is basically an app that is giving voice to babies. And, as a parent yourself, I'm sure you recognize the challenges of understanding your infant when they were just born. As an adult, if your head hurts, you can say that. If your stomach hurts, if you're hungry, if you are sick, you can say exactly that and get the help you need. But if a baby is hungry, they cry. If they're in discomfort, they cry. If they're sick, they cry. And really, Nanny AI is an attempt to give parents, but also physicians the power using AI to understand really infants' physiological state to basically provide them the care they need to thrive.
Yeah. Awesome. I'm going to ask you in a moment how it works exactly. But I do know, having reviewed baby monitors, even recently, some of them have what they call as a cry detector. And one model I can think of has a cry decoder, which also aims to identify to parents or babysitter why the infant is crying. Is it fatigue? Is it hunger? Is it pain? Just general crankiness. So is that the same idea that the app listens to the baby and then will tell the parent why the app thinks or the AI thinks the baby is crying?
Yes, in a way. And, that's the core idea, is really understanding the infant's needs. But where we extend this is going also to the infant's health as well. Because one thing that is less known is that babies who are sick have different cry patterns from babies that are healthy and normal. And so the approach we've taken at Ubenwa is really working closely with pediatricians and neonatologists in hospital settings to basically map the signs in the cry that change when a baby has things like respiratory issues, neurological problems, and so on. And so it's this idea of like a full cry decoding, if you want to put it like that, or interpretation to say, first of all, why is the baby crying? Is it due to some physical need right now? Is it hunger? Is it pain? Is it discomfort?
Yeah, like a wet diaper.
Exactly, like a wet diaper, temperature, they're too cold or too hot.
Sure.
There's several subcategories we can actually detect there as well. Up to saying, is this cry anomalous? Does it relate with the kind of patterns we've seen in unhealthy babies? And is this an opportunity to tell the parents to, go and see the pediatrician to get more assessment?
And can you walk us through how it works? I'm assuming if it's an app, it works on your phone or a tablet, it listens. And how did you get your data? Like, how does the AI know the difference between a cry tied to a dirty diaper versus being hungry or bored?
Yes, exactly. Yeah, great questions. So first of all, it's really simple. It's really just an app, a big button that you can tap, and it allows you to record a baby's cry, about 20, 30 seconds capture. And then that's all it needs to really infer the reasons for the crying. And then it's going to give you soothing recommendations of what you can do immediately. The nice thing is that the more and more you use the app as a parent, then we are able to monitor a baby's cry biomarkers, we call them, through time, and then tell you if ever we observe any, unusual signs in it as well. So it's very simple. And then how do we build this? As I was hinting on earlier, we really had to work with clinicians on this because there was no other way to get the kind of reliable, annotations that we need. And so, unfortunately, babies are not being recorded today as part of medical records. And so we work with doctors in Canada, in Brazil, abroad as well, and basically recorded infants in the hospital setting and then label these cries with the clinician. So we're able to know a pain cry because, the doctors who are performing a painful procedure like a blood draw when we capture that cry. And so with this structured process, we're able to gather this really massive database of infants crying for different reasons. As you might know, AI feeds on data. We can now take this cry data and labels and give it to our AI to really learn the patterns that are there.
Fascinating. We're chatting with Charles Onu. He is the CEO and co-founder of a company called Ubenwa Health based in Montreal. They have an app called Nanny AI. It's Nanni AI. It can listen to an infant's cry and help to decipher what the child is crying about. Where do you get your name from? For our listeners, it's spelled Ubenwa, Ubenwa.
Yes. Ubenwa is the name of the company, and it's from my native language in Nigeria. So I'm originally from Nigeria, and it means the cry of a baby.
Oh, wow. That's cool. Yes. I love it. That's great. Can you tell us more about the AI assistant that's built into this app and any other health features that you've hinted at earlier?
Yes. So, as a parent, there's always all these times where you have a question. My baby's poo is green today. Is that normal or something or the other?
That's a teething thing, right?
Yeah, exactly. And, we have this very nice AI chat assistant now in the app that you can just exchange with, like it's another person on the line, like on the messenger, and it gives you responses that are qualified from the CDC, the American Pediatrics Association, to basically address some of these common answers. And it's automatic. You can ping it at midnight, 4 a.m., 3 a.m. It doesn't need a human to be awake to answer you and tell you what to do. And there are other cool things about the app. For instance, with recording your baby, you can activate it with your smart assistant like Siri or the Google Assistant as well. And so parents have told us they use it a lot by just saying, "Hey Siri, open the Nanny app," and then opens the Nanny app, record, and it records, and they just get the answer without even touching their phones. Very soon we are going to have like the iWatch integrations coming in, so parents can use their mobile devices as well. So there's many cool things to come as well for parents on that front.
You mentioned the Apple Watch. Does this app only work with iPhone, or does it work with Android as well?
It works with both, actually. So to date, we've now had almost 200,000 downloads of the app across the world within just the first few months of launch, both on iOS and Android. Parents seem to love it. The reviews on the app stores are really great.
Before we wrap up, and just to play devil's advocate for a moment, what if there's a false positive, Charles? For example, it suggests that there could be a more significant or profound reason why your baby is crying, and the parent's stressed out until they have that confirmed or denied by a pediatrician. Can that happen where it suggests that there's something seriously wrong with your child when in fact it's just the way they cry,
Yeah, no, the key thing right now is that the app is not a diagnostic app.
Okay.
It doesn't make any medical predictions or suggestions. The goal is to get there, which is why we're working closely with doctors, not only to get there, but to get there and get it regulatory cleared by the FDA, the US, and Health Canada in Canada as well. But we're not there yet, and so we don't do any diagnostics or any recommendations yet for parents. It's really more of suggestions as to why a baby is crying today. And then if we observe any unusual patterns, we will point it out to you. And as a parent, usually you have other clues as well that maybe something is not up. And perhaps this will give you additional data to combine with the visual signs you're saying to, decide to go and see the doctor.
All right. And then finally, where can we learn more about the app? Do we just look for it at the App Store for iPhone and iPad and Google Play for Android, or is there a website you would recommend?
Yes. So the best place is to go straight to the App Store. Just search for Nanny AI and you'll find it usually as the first result, either on the App Store, on iOS, or on your Android Play Store.
Okay. Again, it's Nanni AI. We've been chatting with Charles Onu, O-N-U. Thank you so much for your time, Charles. Really interesting technology. I'm going to download this myself, even though my kids are now in their 20s. I'm still curious to see how this would work with some of my friends who do have infants. So thanks again for teaching us about this.
Yeah, it was a pleasure chatting, Mark. Cheers.
All right. Well, this is the first of two VivaTech 2024 special editions of Tech Talk. I'm in Paris, France. And so I hope you enjoyed the interviews I played this hour. The first two were from the show floor. And next weekend, I will play two more. One with a company out of Waterloo, Ontario that creates indoor maps used by about 1/3 of the shopping malls in the world, which is a pretty cool success story for a Canadian startup. We're also going to learn about using AI to detect liver disease from an ultrasound. So very cool stuff coming up next weekend. Feel free to hit me up on social media to let me know what you would like to hear next on Tech Talk. It's Mark Saltzman, MarcSaltzman, signing off from Paris, France. Have a great rest of your weekend, everyone. I look forward to catching up with you next weekend for part 2 of this VivaTech edition of Tech Talk. All the best, everyone. Ciao for now. Or should I say, au revoir.